Dr. Ronald Chibuka. When I first saw the results, I was shocked. I couldn't believe that I had failed. Experiences and factors associated with mistakes, local failure, and professional courses in Sub-Saharan Africa. Ronald Chibuka, in the house, please, you have 10 minutes to present and shut up to do for about 5 minutes. Thank you.
Yes, I'm called Ronald Chibuka and I'm a protege at Africa. I'm here to share with us that associated with retakes in health profession courses in Sub-Saharan Africa. To be specific, there were 2 courses that were posted, that's medicine and nursing. So one fact is retakes are very negative for health professional education. Improving how assessments are done and on noting out the key challenges that could have led to this. And this can lead to better academic outcomes and even better welfare of these same students. So in this study, this was a mixed method study where we started with interviews and then progressed to so we started with questionnaires, then progressed for interviews, and we involved 5 universities from Sub-Saharan Africa chosen to have a good representation, but also because the grant that carried out offered to these universities. And the university one was Bustema University, which is in Uganda. We had Muzunzu University from Malawi. We had the University of Ibadan from Nigeria, Kwame Nkrumah from Ghana, and University of Zambia from Zambia. So our dependent variable was retail currency, and then we had the independent variables that as indicated. So the four considerations: one, we had a memorandum of understanding signed between the VCs of the different institutions, witnessed by either the dean or the academic registrar. We had FCO clearance from the booths rec, and then administrative clearance from the participating institution. So our results: we approached 851 students, and these were all final year medical nursing students from the participating institutions. And from these, we recruited 764, and majority of whom were females, accounting for 61.9%. Christianity was the highest region that was seen, which is 90.4%. Our age ranges were 18 to 49, with an average of 25.3. And more than half of the participants were aged between 18 and 24, and nurses were covering the majority of the lot with 64.5%. All were bachelor's holders. So these were different from the different universities. Budget to our university of it was Muzunzu with 25%, and Bustema had the list with 11.1%. But to note, this is the number from Bustema, so everyone from Bustema actually participated in this study. Bustema had the list with 11.1%, but to note, this is the number from Bustema, so everyone from Bustema actually participated in this study. So these are our proportions of retakes for the students. One thing to note is, like I said initially, they are inevitable. There were retakes from each institution, even when chosen at random. And this is where I pose a question. When a student gets a retake, is it the student who has failed, the lecturer, or both? That's to all of us, yeah? Because along that we realize that when failure strikes, much of the blame is passed to the student, leaving out a lot of other key players, which is very important. If we are to have a scenario where we shall have a university with no retake at all, yeah? Because all these players play a role. And from even, I try to look back from even primary, when a kid fails at P7, a kid has failed. Bustema, since we are in Bustema, and then the overall. The only beauty is somehow the proportion of students with retakes in Bustema were equal to the overall when combined. Like the proportions, not the numbers, which were both 12.6%. That's in Bustema, and then our overall is the one at the lower corner, 12.6, and those were around 86 students. They had ever experienced retakes. So from this, we went further. Maybe from this,
I wanted to note out one of the reasons as why because you realize each institution has different proportions. This is because different institutions have different evaluation techniques, and these contribute. For example, Muzunzu had the highest proportion of retakes, which was 22.1%. And when you look at Muzunzu, they have a license exam like after. So before the university lets you go, they have to make sure you're thoroughly good to go, because the other exam is looked at by the nation such that you either do not shame them or something like that, yeah? So the differences in the evaluations cause these discrepancies. And then we had the list in Kwame Nkrumah. Someone could look at it as having less strenuous evaluations or more support systems. So either way, I think we might need some more deeper. So after that, we looked at the modes of evaluations that were mostly looked at contributing to retakes. So I'll still focus on Boostem and the overall. So at Boostem, most students got retakes from long cases. And when you read about long cases, this is one of the traditional ways of evaluation. So in long cases, I pick up a patient, I clerk, I make my notes, one examiner, one student. So it's been noted to have very many occurrences of biases. So this is why you realize that even these things come up. And then we had the lowest in OSCE. OSCE is the new improvised way of evaluation, whereby a student gets to different stations, and it's like every student goes through the same evaluation. So it's for clinical skills, but it's been found to be more subjective than the long case. Then 40% got retakes from a combination of the different methods. Then overall, most students actually had retakes in OSCE. Why? Very many institutions have taken on OSCE as the main evaluation model for clinical skills. So realize that some of these are what are not really taken up. So in the univariate evaluation, these were the factors that were contributing to retakes. So we looked at the demographic factors vis-a-vis our dependent variable. And I'll note out the main. So we looked at the demographic factors vis-a-vis our dependent variable. And I'll note out the main ones that were of concern, and that was gender, and the other one was age group. This is at univariate. So still Bostema and the overall. So males had an odds ratio of 6.7, which is quite high and worrying. Yeah? And when you look at background, as discussing some of the it seems we neglected the boy child some time back, and these are just some of the aftermaths of that, yeah? That we believe the boy child believes is self-sufficient, he believes he cannot consult when he has not understood, and then the other question is, most likely maybe the environment is not so good for you to consult. You find that a female child can easily come to consult a child that has not understood this, repeat for me, and a boy child, because from home you've taught him that you're a man. How do you tell people that you've not understood? And these are contributing to this. So this point out one important factor. So we have a lot of things as we progress to empower the guidance, like I said initially, the guidance is focused more on to the girl's child. When the girl child does a mistake, the world is ready to come up order, and then when the boy child does a mistake, usually they let us just read. So people here, please let's wake up before we fully lose the boy child. It's very, very important. Then the other factor that came out was age. For my results, the older you are, the higher chances of having a retake. So the odds ratios keep increasing, yeah? The older children were more likely. And this obviously comes out that usually the older students have more responsibilities, married, work, and the rest. And we subject them to the same teaching environments with someone from senior 6, you get? Someone has had, let's say, 3-4 years away from school. And, okay, I'll just be like lecture wherever I stop, I'll share the slides. So this was the multivariate. Still, there were the main two things that came up. It was gender and age. I wanted to move through the qualitative. So in the qualitative results, we got 3 participants from each institution, and we tried to look at all. These are quite long, so I request that I go wherever my time gets done, that's where I'll stop. So we started at the emotional
and psychological impact. What a student really thinks into their mind when they've just gotten in that, hey, look here, I have a retake. So this is usually was associated with shock, fear, anxiety, and notably suicidal thoughts. Like one student noted, when I saw my marks, I couldn't believe I had failed. I was shocked and overwhelmed. Then another just sighed and was like, it's hard, it's hard, it's hard. I knew that this is going to be on my transcript forever, no matter what I do. Meaning a student is scared that even if they are willing to come back and do a retake, the system has made it that you'll have to explain to your employer, to your children, that retake. You put it as I don't know if people can look into that, but this is a worry too. Most students will get the retakes that they're willing to repeat, but you always give a mark. Then one student had to change the environment, so I went to a village because I just didn't feel well. Then the other said that. Then we had the fear of failure. So this was not a doubt. Students were scared of failing again, you know. I'm not sure that I'll pass the next time. Then however, some students noted resilience and acceptance. So I admit that I failed and I don't dwell much on it and I quickly move on to prepare for the next attempt. So it's not a good experience. Anyways, anyone will want to pass at once, and giving a retake is something that will give pressure. So I'll try to move through first. So on the challenges, noted were systemic challenges, unfair treatment, and inadequate preparation. So OSCE is unpredictable then.
I'll try to move through first. So on the challenges, noted were systemic challenges, unfair treatment, and inadequate preparation. So OSCE is unpredictable then. One bias that was noted out: if you are not in good terms with the lecturer, they might give you a lower mark than you deserve. Then one noted out, maybe it's not studying enough. Obviously, he said, not following the schedule during the evaluation or clinical evaluation. So the other noted, because you fail to prepare honestly, it takes your confidence. Once, as a student, you want prepared in the exam, actually you lose the confidence. Then one challenge that was noted out, and this is the most important one to us here because we are lecturers, the lack of feedback. So students noted out that someone fails and all they get is you failed and you never give feedback on where they failed. So one noted, to retake an assessment.
Sure where I went wrong because we do not get detailed feedback. Feedback has not given to us, something like that. So then we went on to repeating the whole course unit was found to be a challenge. Then we went on, someone noted out the statistical factor towards retakes and noted the mere fact that the system allows for the instance of retakes increases the chances of what? Getting retakes. So the coping mechanisms. So the coping mechanism one was acceptance of failure and focus to improve what's that? Then we had noted was most people relied on peer and parental support, and noted out was there is no universal support in this thing. It's like you're left to ride alone. The impact on self-perception. So student self-perception, usually most of them it went down, like noted in this course, but because of the time. So I feel like I don't know where in my studies and I'm unteachable, I can't even succeed. Then there is students noted out, they noted out that they got a chance to grow academically with these retakes. Then the challenges on retake preparation, we have time constraints and the rest. Then we have financial challenges because someone has to repay. And then support systems, yeah, the 30 seconds can't be enough, I go to the conclusion. So the suggestion for improvement, I read just the codes up. Our students suggested detailed, timely feedback and transparency in assessments, and then structured academic, counseling, and emotional support from the institutions, and then repeating only what someone has failed such that they can actually focus on that. Then the external factors. Then in conclusion, the study highlights the multifaceted nature of retakes in health professionals education in Sub-Saharan Africa. Gender, age, and institutional factors, particular assessment methods significantly contributed to academic setbacks. So the recommendations for improvements included providing detailed feedback, transparency in assessments, and enhancing both academic and psychological support systems for students, particularly those at higher risk, notably the older students and then the males. And then we suggest further research to investigate the long-term academic impacts of these students, especially towards their career. So I end by thanking the team that we worked with, And then also Africa that funded this project. I remain, Chibuka Ronald. Thank you.
Thank you.
All right. Thank you very much. I hope they don't look at someone's transcripts and say you can't stand to be Director General. Anyway, can we have some questions? Shall I have about 4 or 5 questions? Someone move around the mic. You write them down, then respond at once.
Thank you for that interesting research. I just wanted to know how you determined the population to study for the quantitative. And also, because you dealt with different universities, how did you determine what proportion to choose from this university and not the other one for representativeness? Maybe a comment is that I realize the assessment standards for different countries differ. And maybe you could find that in a certain country, there are more people who get retakes. The proportion is higher because the standards may be a bit tough. So wouldn't that affect generalization? Just that. I would think maybe it would affect the generalization of the findings that you get, that it would apply maybe over a wider geographical educational landscape. Thank you.
Next question. Let the question be on point, brief.
Thank you, Dr. Kibuka, for your presentation. Mine is not a question, it's just a comment, especially on what the students said. The lack of feedback is very, very important. But I note that I think we need to innovate on how to do this in our curriculum. You find that you assess students maybe end of course on a Friday, and on Monday they are starting another course unit. There is no time even to invite these people so that you give them feedback. Even as you are marking, they are already in another course unit, and you realize that I think this number, many students have failed. It means they didn't understand, but you have no way of inviting them back to give them this feedback and maybe even go over what you think was not done well. So as teachers, I think, I don't know what we are going to do, but we need to find time in the curricula, which are really packed. There is no time. Thank you.
Right, thank you, Professor Chalo. I want one more question, then Dr. Chibuka responds, and then I invite the next presenter.
Thank you very much. Mine is not a question, but possibly a suggestion. Just like Madam has hinted, most times we tend to teach towards the end of the semester, not giving enough time for the students to actually understand what has been taught. And then secondly, I got a chance where in one of the country, you find that before a semester begins, students who got retake are given the papers to do. They actually don't wait for the time again, go through the course again, and then do the paper again. So maybe for the concerned people, this can be a point of discussion, so that before the next semester begins, a student who has gotten a retake would redo the paper and possibly proceed and finish together with the rest of the students. This can be discussed at a higher level, I know, and if it can be adapted, that would be also another good thing. Thank you so much.
All right, thank you very much for the comments and the suggestions. The curriculum implementers are here, and I think it will be given further thought. So, Dr. Chibuka, can you respond?